We need to be careful because we don't know who will get it.
Kids are known for spreading the common cold and flu, but in the midst of a global pandemic, BC researchers are trying to figure out how many kids and young adults have already been infected by the novel coronavirus that causes COVID-19.
We know that for most infections and most viral infections, children are a key part of transmitting the virus through communities and through society. We haven't seen that so much in this pandemic, based on the testing that's been done. However, we know that a lot of that depends on when children go for testing, and we also know that some children have COVID-19 without any symptoms whatsoever.
The research, called the Spring Study, is being carried out by BC Children's Hospital and the University of British Columbia.
The advantage of the antibody test is it enables us to be able to tell who's been infected in the past, irrespective of whether or not they were tested at the time of their infection.
UBC's Dr. Manish Satarangani says there's little information on COVID-19 in children because there have been relatively few cases. But a Vancouver family has first-hand experience with the virus. Anson Ann, his wife, and two oldest school-aged children all tested positive for COVID-19 this past August.
I think this virus is dangerous is because the symptoms are so mild or almost like none. But yet it can still spread to a lot of people, and that's why we have to do more research. And especially for children, as I see my kids, they just seem like normal, and that's why we have to find out how we can prevent children from spreading to others.
The Spring Study is searching for thousands of participants. Those interested will be sent an online questionnaire and an at-home finger prick test.
We'll be able to get a better estimate of how many children and young adults have been infected with COVID-19 during the pandemic. We'll also, with the data we're collecting from people, we'll be able to compare people who've been infected with those who've not, to try and identify what's maybe different about the people who've been infected.
Let's remember, everybody are at risk, and just be very careful.
If you're interested in participating in the study, you can visit www.bcchr.ca for more information on how to get involved. Miranda Fatour, City News.